alaikum wa rahmatullah, peace be with you, and welcome to this last episode in the series Understanding and Addressing Vaccine Hesitancy in the Muslim Community from an Islamic Perspective. In this episode, we will be looking at the importance of vaccine, the roles that vaccines have played within human history and Muslim society. We would want to also look at the role of Muslim scholars in helping and what they can do to reduce some of the challenges we have when it comes to vaccine hesitancy and anti-vaccine sentiments. But also, what is the role of Islam? What are those principles of Islam that are critical in playing a role in helping us deal with the challenges? And what role can both Muslim scholars and health practitioners play to bring an end to various diseases, both in the present and as we move into the future? I am your host, Muhammad Nuruddin Lemu, and with me to discuss today's episode are two of our distinguished facilitators over the last couple of programs and episodes in this series. Brother Ibrahim Bello, who works with the IBB Specialist Hospital and is a master's in biochemistry, and our microbiologist in the room, Sister Rukaya Kinta. You are both most welcome. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah.
Let me start with Brother Ibrahim. What has been the role of vaccines? How effective have they been? What importance do they play when it comes to healthcare of Muslims and everybody else?
Yeah, throughout history, since the discovery of vaccines, they have played a pivotal role in significantly reducing the burden of deadly diseases, either by eradicating them or minimizing their impact. Typically, you have the case of smallpox, and then polio, and in fact, even the so-called child killer diseases, measles, tuberculosis, whooping cough, diphtheria, and co. With data, researchers have shown that these vaccines have been very, very effective in minimizing or even eradicating some of these things. When you compare communities where children were immunized against these things and where they were not. And also, like we know, in the what you call prevention, primary prevention in the public health, basically you are looking at hygiene, reorientation, education. Vaccines belong to that category, which is far, far cheaper and easier than managing complication or even treating, because you have stages of prevention. You have primary prevention, you have secondary prevention, even the tertiary. Primary is what you do to prevent. So vaccines belong to this category. Also, the burden of managing most of these deadly diseases is far, far beyond the earning of families within low and middle income economy. So it is always better that we take these things serious and we give them all the utmost attention and importance they deserve, because they save life and they are cheaper and in fact safer. So the most important thing is for us to get it right and know that these things are very, very important and vital. And with history and record, this is how effective they have been in the past.
Sister Kinta, what would you add to this issue of the importance of vaccines compared to other forms of medication that are important also?
Thank you very much. I think Father Ibrahim have really talked about the efficacy of the vaccine, and researchers have shown clearly how effective they are. And the challenging thing is, despite all these efficacies that have been mentioned, vaccine hesitancy continues to remain a challenge, especially in communities that have been exposed to misinformation, conspiracy theories, and lack of trust, I will say, in medical authorities. And this vaccine hesitancy can be really, really detrimental, because it can lead to death and outbreak that on a normal basis can be prevented. Look at what happened during the COVID-19 and also many other disease outbreaks that actually happened. So these are things that we can actually prevent, which are even more economical, safer, and if we don't actually resort to them or use those vaccines, it can lead to many, many things that we can actually prevent. So I think it's important.
And, just to add to that, just recognizing that as we get new diseases appearing, whether tied to our lifestyles, whether it's new bacteria, new viruses that we didn't have before, but joining communities and affecting all people, whether it is sexually transmitted or airborne, whether it is like at the end of the day, you still get innocent people being affected and dying and suffering, and the need to try and see what can we reduce of the number of diseases that doctors have to tackle with, that tackle or families have to struggle with, and vaccines seem to be one of those most effective in ensuring that we don't carry into the future some diseases that prevention actually could have helped us with. Sister Ruqayya, along the same lines, what roles can religious scholars play in reducing vaccine hesitancy? What role can they play in responding to anti-vaccine arguments and sentiments and promoting greater health through vaccination or immunization programs?
Thank you very much. Religious leaders like imams, scholars, leaders of Islamic organizations, teachers of Islamic studies in our secondary schools, in our tertiary institutions, teachers in our Islamiyat have a great role to play because they serve as pillars of guidance in Nigerian communities. These are people that people look up to, and when they speak with authority. So I think they need to be champions in promoting vaccine. But first and foremost, they need to be intellectually vaccinated to get themselves ready to dispel any anti-vaccine issue that comes their way. And I think if they are really ready and they get themselves intellectually vaccinated, they will be able to inspire their communities to take more preventive measures when it comes to diseases.
And Ibrahim, what would you add to her?
Yeah, as religious leaders, Islam has core values or higher intent, of which there is protection of life, wealth, intellect, and all of that, of which the intent behind vaccination perfectly aligns with this. So this can empower religious scholars, particularly Muslim scholars, to be the champions of this. Also, vaccine fits or suits the critical thinking tools of legal maxims of Sharia, where you have actions are built on intent, harm must be eliminated, hardship be facility, and all of that. So Muslim scholars should actually get these things right and get empowered. Okay? And wherever they are not clear, they should consult experts. And once they are clear, they should be sincere and be the champions of this. Among the things they can do, they should use their authority and the trust of the public they earn to dispel misinformation, to clarify misconceptions, to encourage vaccination, to rebuild trust with health authorities and even the government. Because the reality is this issue of vaccine hesitancy is a problem, because like vaccines, like I used to say, is not a one-off thing. One new infection will always emerge somewhere. And once the expert go back to drawing board, they will come out with a vaccine. So scholars should be at the forefront, and they shouldn't underrate their position or their podium in enlightening and educating people. Because one of the best things that will happen to a community is when religious leaders come together with the health experts and scientific community to lead and guide the ummah. Many wonderful things will happen.
Jazakumullahu khairan. And I think, this point you are making, that vaccines are not just one-off things.
Yeah, no, they're
actually not. The trajectory, and as we look into the future, people are looking at more roles for vaccines to play in eradicating malaria. Those results are expected hopefully before long. People are looking at various other diseases that vaccinations could help eradicate. And if we just keep having problems with vaccination as a whole, we tend to suffer, and our communities suffer due to our own ignorance of what's really going on and this question of who we listen to. But you also mentioned some things related to the maqasid of Sharia, the objectives of Sharia, and its alignment with vaccination and prevention of problems. Could you say a little bit more about how Islamic principles such as these critical thinking tools of Maqasid Sharia, Qawaid al-Fiqhiyya, how do these principles align with vaccinations?
Yeah, the primary essence of vaccination is to prevent, infection, particularly viral and bacterial infection. And the essence of preventing and avoiding infection is for your health and to protect your life. One of the core essence of Islam, of course, is hifzun nafs, preservation of life. But along with that, there is preservation of intellect and preservation of wealth. But then, if you are incapacitated, there is a financial burden. It affects your wealth. Most of these infections will even affect your honor as an individual, as a Muslim, as an individual. It will affect you intellectually. You don't think well. You are not yourself.
And all of these
are among the, exactly, that's what where I'm going. They're among the maqasid, higher intent, like the main core essence of Islam as a religion. So I think Muslim scholars should be the first to welcome vaccine, considering the fact that the intent of vaccination and cure is the same. What is the intent of cure? Is to eradicate disease.
Yes.
Absence of disease. The intent of vaccination is to prevent it. And in fact, vaccination is even more awla, because there's a rule that says al-wiqayatu awla min al-ilaj. Prevention is always better than cure. Yes. So all of these align with the intent of Sharia, which is very glaring to Muslim scholarship. Again, when you look at the qawaid al-fiqhiyya, al-umuru bi maqasidiha, actions are built on their purposes. Like we said, what is the intent of vaccine? Clear. Ad-dararu yuzal, harm must be eliminated. What harm is worse than ailments, than infection, than epidemics? Usually most of these vaccines are produced when there's an epidemic somewhere, or a particular disease occurs somewhere, and you want to forestall reoccurrence somewhere. So this is very clear. Then you have issues like al-yaqin la yazulu bishak. Basically, this is telling you that you need more scientific proof and evidence to base your judgment, to base your arguments, to base your formulation of theories and even the vaccination.
And who you listen to.
Who you listen to. So scientific data, research, and experts have all of this. Like all of this just come to fit into that. The essence is you want to be more certain, you want to be more sure. So Muslim scholars should be empowered with these tools and use them to champion the cause of vaccination. And with that, they can lead the Ummah in the right direction. And the most important thing, like I said earlier, is let them get convinced. And once they are convinced, they should be sincere in who they lead. Wherever they are not convinced, they should try to get it right by consulting the experts.
Sister Kinta, what would you add to that?
I think Mala Ibrahim have actually said it all, but just to re-emphasize the importance of scholars to get themselves acquainted with usul. It is really, really important, especially the qawaid al-fiqhiyya and also the maqasid al-sharia. And even when something has an issue, look at what is the highest intent. What does it seek to achieve? It talks about the preservation of life, because you don't want people to die. You don't want to, because as a community, even when you are healthy, when you are well, you'll be able to have to worship Allah. You'll be able to move the community forward. So it's important for scholars to get acquainted with the maqasid al-sharia, qawaid al-fiqhiyya, and usul generally before they give out fatwas which might not be in line with these principles.
And, so this point you're making about exposing more of our scholars to the critical thinking tools of Islamic jurisprudence. You mentioned usul al-fiqh, or the principles of Islamic jurisprudence, the maqasid of Sharia, the objectives and higher intents of Islam, the legal maxims, or the qawaid al-fiqhiyya, that help scholars identify truth for what it is and be able to guide their communities better, but also to recognize what is not true. So these critical thinking tools are very important prerequisites when it comes to responding to misinformation. Sister Rukaya, what else would you add when it comes to this whole area of dispelling misconceptions about vaccines and the role of Muslim scholars and healthcare professionals? What would you say there?
Alhamdulillah, I think in all this series that we had, we've been talking about the some of the issues, fears people have surrounding vaccine, things related to conspiracy theories, to misconceptions, issues related to side effects. And alhamdulillah, we've been able to tackle some of these arguments using scientific evidences and faith-based arguments. So scholars need to get themselves acquainted with all this so that they can be able to champion vaccination in their various communities. And I think it is also important for us to have this ethical obligation to, as Muslims, to dispel misinformation and be careful of rumors. Allah subhanahu wa ta'ala said in the Quran, so we should know where we take our information from and how credible our information, the evidences we have, before we conclude on issues, especially in the case of public health issues, where when we play with it, it leads to death and more severe consequences. Inshallah. Thank you.
Ala Ibrahim, what would you add to this issue of the role of religious scholars and healthcare professionals? What can they do?
They can do a lot. Religious scholars are the champions of guidance, morality. Healthcare professionals have been trusted for their expertise in healthcare. So if religious leaders will use the wisdom and religious texts along with the expertise of the healthcare providers and collaborate in enlightening and guiding the Ummah in the right direction for the well-being and the health of the society, and also to combat preventable diseases. Because basically, this is one thing people should know about diseases. And that's one mistake Muslims make. People who are not proactive and don't plan, 100 times calamity will befall them, they will say it's destiny. But maybe 90 different times, the same team, those who prepare and are proactive, will get saved. That tells you the importance of what? Planning and preparation. There is Gaya and Wasila. So we should know that there are Wasila. So this knowledge of health, all these wisdoms are means to treatment, to eradication of diseases. They should also use their opportunity to dispel myths, to say the truth, to clarify misconceptions, to educate, to empower the society, and in fact, to guide the leadership in the right direction. Because sometimes people are even more loyal and submissive when they have issue of trust with the leaders. It's religious scholars they use now. So they can use this podium to rebuild trust, to guide the Ummah, and hopefully have a healthier and safer Muslim community.
MashaAllah. And I think, sometimes there's a level of arrogance on both sides. On the side of the healthcare professionals, actually many professions they find where you have titles like doctor, imam, barrister, engineer, pharmacist, tend to be professions where they are very protective of their fields and sometimes look down upon others and their role. And so sometimes what you find is, and you see it the other way around too, you find medical professionals not ready to work with religious scholars, not appreciating the value and the amount of capital in form of trust that this religious scholar has in his community, or which she has in her community. Just as you sometimes find the arrogance the other way around, the religious scholar not listening or even believing the medical professional who you would have thought, wait, on this subject area, this is the person who you should listen to. So sometimes you have this clash of arrogance and pride, and the community suffers from that. And so the need for, I think, those in the healthcare profession and public health and dealing with epidemics and plagues and pandemics to recognize they can't do it all and they need support, especially when the healthcare professionals have not been around at the grassroots. They've been in the big cities. When last did a doctor appear in some rural clinic to help anyone? And then suddenly you start talking and you want everybody to follow you. People usually go by who do they normally trust. And very often it's the religious scholar who is generally the more educated. Even you say, oh, it's a country of the blind, the one-eyed is king. No problem, but he is still king. So even if you don't recognize him, the thing is, if you want to help the community, you have to look at who do the communities trust. Just as we would get the religious scholars to recognize that when it comes to healthcare related issues, these are the experts. But also those religious scholars who have understood the science behind vaccines, have have had their own misconceptions or misinformation dispelled, to play a critical role in educating their colleagues through workshops, through the critical thinking tools of usulul fiqh and Islamic jurisprudence and legal theory and principles, the maqasid of Sharia, as you've mentioned, and the maxims. These are critical for scholars to understand, because they play the role of being like an operating system, where once scholars understand them, then it's easy for them to get your arguments and analogies and that type of thing. So training of religious scholars formally, building bridges with the healthcare professionals. And I think here we have an important role for organizations like Iman, the Islamic Medical Association, and many of these Islamic medical associations, whether from students or whether it's from the professionals, to build better bridges between the NCDC, the National Centers for Disease Controls, the World Health Organization, and these authorities, and the grassroots ulama. As we come to close, I'd like to ask both of you if you had one piece of advice, maybe two, but if you had one piece of advice, and I'll start with you, Sister Kinta, to give Muslims who are hesitant or against vaccinations, those who are sitting on the fence and undecided, and those who are still not convinced, what would your what pieces of advice would you offer?
So I think what I will say is, if you are to forget everything that we have said so far, one key thing that you should have in your box, your toolbox, is one, those critical questions. Very, very important. Where do you get your information from? Any information. Remember, so the first thing is, where do we get the information from? Is it from Facebook, from Twitter, where? Then the second thing you need to ask yourself is, how do you know it is true? So you have to ask, is information actually true? Or is it just someone will sit and feel like he wants to be popular on social media and you start...
It has gone viral.
Yeah, it has gone. Let me just say it so that people will look at it and I will get more likes. So how do you know it is true? I think the third question you need to ask is, how credible is the evidence that he's actually talking about? How credible? He himself that is talking, how credible is he in the field?
Or she.
Yeah. And the last question is, do you have any other information which is more credible, from a credible authority actually talking on the issue? So I think this is very, very important, and this is my just takeaway. This should be in your brain. It should be in your box. Any information regarding vaccines, this should be the first 4 questions you should ask yourself before making any judgment.
So where do you get your information from? How credible is that source? Yeah. Do you have a source more credible than World Health Organization or the recognized authorities? Alam Ibrahim, what would be your own?
Yeah, so far, this series have tried to foster good relationship and enhance understanding on the safety, efficacy, and necessity of vaccines. It also tries to encourage good rapport between the scientific community, who are the health experts, and the religious leaders in leading the Ummah in the right direction when it comes to issues of vaccine. But that said, my advice would be, number 1, for us to acknowledge that yes, there are legitimate concerns by the Muslim community most of which boils down to issue of ignorance of the science, believe in conspiracy theories, and trust issues with government. However, all of this, looking at the track record and the evidence available to us, do not in any way justify prohibition from religious perspective. Instead, the religious perspective is actually encouraging, and it could be mandated. The second thing is the scientific community, religious leaders, stakeholders, all of them should collaborate in re-educating, rebuilding trust, dispelling misinformation, and empathically and respectfully addressing the concerns of the doubting Thomas.
No.
Why? You cannot coerce somebody who is not convinced. While those critical thinking tools are important, but they're only important to somebody who is learned. So, you should try to convince somebody beyond just persuasion. Now let him see the good and the importance. Because if he does not, he could still be hypocritical. We've seen cases where a man will leave his house and tell his family, don't allow anybody to administer this thing to you. Because some people are not convinced they're hypocritical, you see cases where even some of the people told to administer the vaccine agree to mark the children's finger when they are not actually immunized. All of these issues goes into issue of they are not convinced, and that's why they are not sincere. So those concerned and those stakeholders, like you addressed earlier on this issue of intellectual arrogance, we are religious scholars, we know everything. No, you are religious scholars, you don't know science. I think we should remove it. And that's why one of the best things that can happen to Muslim community on these issues of vaccine hesitancy is when the scientific community and religious leaders agree to collaborate for the betterment of the Ummah.
MashaAllah, I would say, Inna fi dhalika la ayatin liqawmin yaqilun. And all you have said is a lot of lessons and wisdoms for those who would think. Because some of these illnesses are life-threatening, the need to really take them seriously and not look at it as just an academic discussion, but very consequential. I'd like to thank you both for your contributions to this discussion. And inshallah, that brings us to the end of the series in the episodes. Until next time, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
بسم الله الرحمن الرحيم